Hello, everyone, and welcome back. I'm Louis Bernetti, and today we're going to be talking about neuro versus orthopedic recovery and how recovery can look after stroke in the timeline. So, for this, I'm going to share my screen with you guys today as we go over today's topic. So, again, we're going over neuro versus orthopedic, and we're going to be discussing the difference between the two and why it's important to understand the difference so that we can adjust our goals and understanding of recovery post stroke accordingly. So, neuro versus orthopedic. So, when we talk about neuro or neurology, we're talking about what's involved in the nervous system. So, our nervous system includes our brain, spinal cord, peripheral muscles, and nerves. And then when we're talking about orthopedics, that involves the musculoskeletal system. So, that includes bones, muscles, joints, and the spine. And so, what I want to emphasize here is that a stroke is a neurological condition. So it's not a orthopedic condition, it's not a musculoskeletal system. It's involved with the nervous system and it's a neurological condition. And it's important that we understand the difference here because again, this is going to help us understand in terms of recovery and goal setting. So when we're also how to understand, we can use that lens to help us better understand what's happening with our bodies or our loved ones. So to kind of help drive this idea home, let's understand it this way. So, when we have a stroke, that is causing an interruption in communication between our brain and our body. So, the way I like to think about this is that let's say you have a more low tone reaction. So, after a stroke, let's say your left arm isn't as responsive as it once was. It's a little bit kind of relaxed. You can maybe get it up a little bit, but it doesn't move as well, it doesn't respond to you as well as it did before. Oftentimes people might think that's just because there's the muscles are weak, or oh, I just need to strengthen my muscles so that it'll respond better and it'll get up and I can move it, or I need to increase my how much range of motion I'm having in it, where actually the muscle integrity of that area and that joint, it might actually be just fine. There might be nothing wrong with it. It's because our brain and the connection between our brain and our body is not responding and telling that arm to move because of that interruption and the damage from the stroke. So the brain's just not even responding to it and letting that happen. So the muscles themselves could be perfectly fine in perfect condition, but it's because the nervous system and the peripheral muscles and nerves, they aren't communicating effectively with our brain. And so it's the same thing when we have what we call a high tone or spastic, when sometimes after a stroke, you might see individuals or you might have your arm like this. It's the same thing, it's just opposite. Your brain is over communicating. It gets you kind of up in this position and it's not letting you kind of relax and let down because it's telling your muscles to do that. So you don't have the control, the voluntary control of your muscles to do that. And so how you work on this is with a neurological framework and mindset. Because if we went at this with a orthopedic mindset of we need to strengthen our muscles and our joints and our range of motion and all that stuff, then you're actually just going to be either increasing that tone or putting yourself at potentially harming yourself because your body's not responding the way it should, and you could be putting yourself in a position where you could injure yourself. So it's important that we understand why we look at it from a neuro mindset. So again, orthopedic would typically involve anything that revolves around like surgery, like such as a knee replacement, shoulder replacement, hip replacement. Those are all orthopedic recovery, whereas not so much a neuro recovery. So I hope that kind of helps clear the understanding between the two and why it's important when we're doing exercises and we're looking at recovery that we're not always looking to just do strengthening. You're not always looking to just strengthen our muscles because it's more we're trying to work on strengthening our brain, our connection with our body. So recovery and how that looks, and if you notice I'm looking here to the sides because I have some couple notes I want to make sure I hit up on. But recovery itself is very different from person to person, but there are two types that we're going to talk about here. And it's when individuals come back after a stroke, you may experience spasticity or flaccidity, which could be more of a low tone, so not quite as high tone as being spastic. And how do you respond to these and how do you kind of work around them? And what's the best way to try to recover from these conditions? So with spasticity, deep daily stretches and potential splints and casting to maintain range of motion is going to be most effective. So what that means here is if you're in this kind of position, not doing things are going to keep increasing that position. So if you're like this, you're not going to be wanting to do curls, right? Because you're just going to be increasing that tone. So the best way to interact with this is to go for deep stretches. Have either a loved one, care partner, or even yourself, if you're able, to slowly apply a deep pressure stretch to that area. And I have to emphasize it has to be slow because if we go for a quick stretch and go really fast, our body can react and kind of jolt back. And when that happens, it's actually going to become tighter because that response from our brain or our body is going to increase the amount of input that's happening and it's going to make it even tighter and more uncomfortable. So you don't want to just go really quick to try to stretch it out. It needs to be slow, deep applied pressure because that slow pressure communicates to the brain that it can let up. There's a constant pressure, and eventually the brain will understand and will relax and loosen up and let go of control. So, really keeping that deep pressure, slow, go down slowly. And once you will be surprised, you can get full extension typically. Let it go down and let it just sit there and stretch for a little bit because it's important to let those muscles stretch, kind of extend out. And then, of course, once you let go, it'll slowly come back up to where it was before. But again, it's important to do this daily to help keep those areas stretched out. And then again, maybe speaking with a therapist or physician about potential splints or casting that could help keep a certain range of motion or a certain position could be beneficial also when dealing with spasticity. So moving to flaccidity or low tone, a good one here is passive range of motion. And so what that looks like is when you have somebody help you move your arm or leg or certain body through a position in space. So take, for example, my arm here. Here, and I'm just flexing it up and down. This is active range of motion. I am doing this on my own. If I were to take my hand here, and let's say this is somebody else supporting me. So this is a care partner's hand, and they are lifting my arm up. And then they're helping me bring it back down. And they're bringing it back up because I am unable to complete this currently on my own. This is called passive range of motion. And so it's important because this is still working those same muscles that you would actively. You're just getting support in doing it. So this is a movement that you may not be able to do on your own, but with support, or even with support of your other hand, if you're able to get that movement. And so that's still working on that same area, providing that kind of strengthening and, that kind of reconnection and understanding between the brain and the body. Electrical stimulation is also a potential other option. Speak with your physician or therapist if you think this could be beneficial for you. And then again, mental practice and functional activity. So this kind of results in something we call neuroplasticity. And so mental practice is super important for that. So if you don't know what neuroplasticity is, it's building up new neural pathways from our brain to our body to complete movements or activities. So after a stroke, like I said before, with it being a neurological condition, it can interrupt pathways and connections of completing movements. So, after it's happened, your brain might have a hard time connecting with your body to do, bring your arm up or move your leg out. So if you're having a hard time completing a certain movement, working on mental practice can be a great way to do this. So the way we like to talk about this is think about if you just sit down and you're doing an exercise. Let's say you're doing high knees, seated high knees, and you're having a hard time getting your left leg to move up, but your right leg can do it just fine. Well, still do it with your right leg, but close your eyes and imagine. So you're doing your right leg, but then once your left leg's turn, imagine going through that movement. So you're really imaging what it would feel like to get your left leg up and down. And you're really picturing yourself doing it, even though you're not currently doing it. Because that is our brain, when we're doing that, is still having to move through that process because you're imagining it. So it's still having to think back on a kinetic memory and go, okay, they're imaging doing this. This is how it looks like. This is what it does. For me to do that, I would have to do this. And so it's going to slowly make that connection between our brain and our body to complete that movement. And that's what neuroplasticity is it builds new pathways to complete these movements. So that mental practice, when we say, even if you can't complete the movement, close your eyes and imagine yourself doing it. That's why we want you to do that, because neurologically, that's strengthening the connection between our brain and our bodies. And then, of course, pair it up with functional activity whenever you can. So whether it be doing it with laundry, when you're doing it, making your bed, eating, anything that you're doing day to day, if you can implement it in your everyday activities, then that's even a better way to practice and strengthen those areas. And then this is the recovery timeline. And I think it's important that we go over because I want to emphasize here that there is no expiration date on recovery. Improvements can always be made after a stroke. There's just general timelines of how recovery can look like. So typically, 1 to 3 months post stroke, that is when we see the greatest recovery and improvement seen. Now, it's important that we understand when we say greatest recovery, it doesn't mean that you get everything back and that everything's going wonderful and that, wonderful progress has been made. Yes, that is true. Wonderful progress has been made, but great progress can still be made long after 3 months. It's just that how fast it occurs is going to be a bit at a slower rate. So from 6 months and beyond, recovery is still happening always after stroke. Our brain's always still making connections and our brain's still always working and improving. It's just at a slower rate. And so having that understanding is important for goal setting and coming up with, how we want to picture ourselves in the future. Because I don't want us to set goals that aren't unrealistic because, as we said, there's no expiration date, but just so we're setting the milestones at times where we won't put ourselves already at a disadvantage, that don't be pressuring yourself that you're like, oh, it's been 9 months. And after 9 months, I still haven't made as much recovery as I did those first 3 months. Well, that's normal. That's not anything abnormal. That just takes more and more time. And that recovery is a continuous process and journey. And so just know that, yes, it does continue at a slower rate, but that doesn't mean it ever stops. And then lastly, we're going to be talking about potential lasting impacts. And what those look like is that a stroke can result in long-term or lifelong impacts and impairments, but they can also result in short-term impairments. And so understanding that, yes, these can be long-term, but that doesn't mean they still can't be navigated around. And so it's important that we understand that a stroke can always, again, recovery can always be made, but there are some parts that may always be living with us continuing on. Doesn't mean improvements can't be made upon them, but just understanding that they may be with us lifelong. And that when we understand this, we can then better make recovery choices and goal setting on how to navigate around them. And of course, these differ from individual to individual. And chronic impairments does not mean, again, that improvements can't be made. It's just understanding so that we don't set ourselves up for failure and that it's okay to understand that, these are going to be with us for a long time. And since I have that understanding, how do I navigate and move around with it? So that's just kind of what I want to emphasize here is that, don't shy away from these lifelong impairments. Take them head on, speak with your therapist, speak with a physician about what are the best ways that I can make improvements with these. And while I'm making improvements, what are the best ways that I can navigate it currently? All right. And so I believe next time we're going to be talking about speech and communication. And so thank you guys so much for joining me today, and I will see you guys next time. Bye, guys.